So are you all ready? Everybody good? So thanks for coming this morning. We've gathered together many times during this pandemic to talk about numbers, to talk about percent positive on tests, to talk about our capacity at the hospital, to talk about the number of patients we have in the hospital, to talk about the numbers, to talk about how it's stressed our team, talk about how it's impacted patients in their lives, and talk about how it's impacted our community. Today we get to talk about one number, number one, the day one of the end of this scourge of a pandemic that has impacted us so significantly. It feels so emotional to say that. It feels so good. Day one and patients one for Stormont Vail and for our community. We'll get the Pfizer vaccine today, one that we know is very effective, and it in itself is an incredible success story. A story of bringing science and technology and money and will and across all kinds of barriers together to create this vaccine in such a short period of time. And we know there'll be other vaccines coming. So it is an incredible success story for humankind, and we are so pleased and so enthused and so excited about day one and patient one here in Topeka today. So thank you for coming, and it feels so incredibly positive to begin this journey to end this pandemic.
It's quite emotional, it sounds like.
It is an emotional day, I believe, for all of us, I believe. It is such a great feeling to see a light at the end of this journey, a light at the end of this tunnel. We know together as a community we have worked tirelessly around social distancing, staying apart, avoiding the social gatherings, wearing our masks, and we have staved off the worst of it. It has been bad, and it continues to be bad, and it continues to stress our system, and during this time we continue to need to do all the things that we know that will keep the pandemic, keep the spread of the virus at bay. It is spreading currently in a rampant, unchecked fashion. So we have to be diligent around those measures. But today really is about this emotion, this feeling, this great opportunity to begin to tamp down, to end the spread of this virus, to end the pandemic, to end all of the ways that it has impacted us so significantly. So I'm sure you have lots of questions about this incredible the transformation of this event center to a vaccination center. It too has been a remarkable journey. We have such an incredible team that has come together, and over the last 3.5 weeks put this together so that we can vaccinate, really be prepared to vaccinate our entire community as the vaccines become available. So I'd like for you to spend some time talking to my two colleagues here, Dr. Jones and Dr. Donna Pudi, about all of the various efforts that have come together to make this possible.
Remind us now, after a person gets a shot, can they take that mask off and walk away free? No more mask?
Well, I think
we know the answer.
Yeah.
So no, that's not possible.
And the microphones, I was wondering if we
Yes,
could,
yep, sorry.
Thank you for doing that.
Yep.
Thank you so much.
No problem.
So no, that's not possible at this point in time. There's so much that we don't know about the duration of protection. We don't know whether or not, and it's assumed that there'll be individuals that still can transmit virus even if they have no symptoms, as occurs now. Will that also occur after vaccination? So many things that we do not know. So from a healthcare provider's perspective, I need to be an example to people that I know in the community, my family, patients I take care of, my colleagues, and so we have no option. We need to avoid congregating carelessly. We need to wear our facial masks for protection. We need to keep social distancing. We need to use masks and hand washing. So
until when, though?
I think we'll know when we see it, when the percent positivity of the test drops back down to negligible, when we have cases drop down to very low levels. Is that going to take? It's going to take a lot of vaccination, and the vaccination process is going to take months. So I think we'll see those numbers, and they'll be clear to see. I don't know when that'll be. Is that going to be middle of next summer? Is it going to be next fall? I don't really know.
Can you speak
speak a bit to the logistics of how all this works. How many folks are you expecting to vaccinate in the coming, immediate next few days? How did you decide who's kind of going to be at the top of the list as far as getting the vaccination?
So that direction really came from KDHE and our federal government as well, CDC. So this first batch, this first allocation we receive is very limited in supply. And the focus really for this first allocation and the direction that we had from KDHE was to vaccinate our healthcare workers, especially the frontline workers taking care of COVID patients. And the reason for that is really twofold. They have a higher level of exposure because they are taking care of these patients every day. So they are a very high risk for contracting the disease, and we've seen that throughout the world in terms of the rate of infection among healthcare workers. And then the second piece is to preserve the capacity of our community to continue to take care of patients as they get sick. If we don't have the healthcare workers to take care of folks that need to be hospitalized, that need that higher level of care, then we're in a worse spot. So that's really why that group was prioritized in this first wave of supply of vaccine, which is, it's very limited right now. We can't vaccinate all of the healthcare workers in the county, so it's really kind of being prioritized as we get that rolled out. And for us here, where we're starting is with our own organization. The first allocations from KDHE were given to the organizations to deploy for their own COVID-facing healthcare workers in those frontline roles.
Will you have to strategize who gets it within your organization due to side effects maybe from getting the vaccine?
We are working through that best we can. Sometimes scheduling constraints don't allow to completely avoid it, but given the window of potential side effects for anywhere from 12 hours to 2 days, typically resolving by 2 days, if folks can avoid being scheduled the day after they are getting the vaccine, we're trying to do that. We're trying to look at doing that. Sometimes that's not avoidable. And the overall incidence of side effects, aside from the sore arm, which occurs very frequently, the overall systemic side effects like fever, chills, body aches, joint aches, muscle aches, those kinds of things occur at a relatively low percentage. So it's our hope that even if we're not able to avoid the scheduling constraints, that we won't create significant staffing issues. But as best we can, we're trying to schedule around it to allow people to not be working the next day, if at all possible.
Is this all 3 hospitals are part of this will come here, or is it just Stormont Vail?
So this effort here today is Stormont Vail exclusively. And in the future, as the vaccine becomes more available, as we get more shipments, as it becomes more widely available, this facility will be used to help vaccinate the entire community and the surrounding region. So, but today's allocation is for Stormont Vail.
How will you track who's been vaccinated and who hasn't?
So, yeah, I think that's it's the shifting microphone.
Thank you for doing that.
That's all right.
We've had an amazing work effort over the last couple of weeks, and including our EMR and our IT systems to be able to schedule people in our electronic medical record so we can track and input all of the details of the vaccination. When they present for this first vaccination, they will automatically be scheduled for the return vaccination, which is required in 21 days. So that way we automatically have it on the books. They get a reminder call. So we have a good penetrance of being able to get people back in that window.
Even if they're not a Stormont Vail patient?
Yes. So we have a process for basically creating a new record in the system so that we have that tracking available.
And are vaccines going to be required at Stormont Vail, or can employees decide not to take it?
So at this point, the CDC has taken the position that since the vaccine is under an emergency use authorization and has, is still going through further study, and further data will continue to be gathered, that they are not recommending a requirement at this point. And at this point, we also don't have enough vaccine to offer to every single Stormont Vail employee. So both of those would be reasons why we're not moving to a requirement at this point, but we're strongly recommending.
And do you have a poll of how many of your frontline workers at least are going to decide to get this or not, this first wave?
So nationally, it's about 70% of folks who have expressed a willingness to get it, and we're seeing a similar rate amongst our team members.
I guess when are you expecting? I know KDHE says they expect the next round of doses next week. Are you all expecting the same? Are you expecting a meaningful increase in the number that you're going to get?
So that's a great question. And initially, the communications were that we would be getting a shipment every week or two. That changed this week. So yes, KDHE will get another round of shipments in the next week or so, but that next shipment will be going to long-term care residents in entirety. So they will be routing those shipments to CVS and Walgreens, who have contracted to provide those vaccinations to long-term care residents. Moderna will also be coming up this week in front of the FDA for their emergency use authorization, and that first allocation will be distributed to health departments, federally qualified health centers, and EMS personnel. That's what it's earmarked for at this point. So at least at this point, the information that we're getting is that we won't be receiving another allocation until after the second dose for this first allocation.
Retirement homes, they'll go there. They won't make residents come here or anything like that, right?
So skilled nursing facilities, I would expect that to be the case. I don't know the specifics with respect to assisted living or the retirement homes, how they're going to be managing that.
Will there be any sort of administrative fee for people who get vaccinated here?
So all insurances have expressed coverage for the administration fee. For those that are uninsured, there are federal support dollars available. So though there will be an administration fee billed, it won't be a patient responsibility.
For folks without insurance?
Correct.
What does a shot cost?
So that's a great question. The vaccine itself, I don't have the information because of the fact that we're actually receiving it from the government at this point. So I don't know what it will be priced at from a purchase standpoint. I know the payers are working through their pricing in terms of what they're going to reimburse, but I don't know what we'll be purchasing it for. And administration usually ranges around $30 or so.
And how long do you expect to have this operation up and running here?
So, the question was, how long do we expect to have this operation up and running? We've been, I believe, granted a kind of a month-to-month with the county to use the facility, and as Dr. Jones said, this effort is going to stretch into several months. So we don't know how long. We hope that we'll have access and be able to use this facility as long as it takes to get the widespread dissemination of this vaccine, or the vaccines as they become available. Okay, you ready to see some patients get vaccinated? Yes? Do we get number one? Thank you, guys.
Thank you.
Morning, Dr. Lewis.
You the first?
Andy's first.
All right.
Go get Andy.
Excellent. Excellent.
How are you feeling?
Fine.
I mean, are you excited?
Stoked. I'm very excited.
Can you give your
Waited a
name?
long time.
Can you give your name?
What's that?
Your name?
Andrew Barnes,
And your position at Stormont Vail?
nurse practitioner in the department.
tell your grandchildren about you. Number one, huh? Right.
Julia. Right. Number 2.
So now he will go over there and sit for 15 minutes so they can keep an eye on him. Make sure no bad side effects. Is that correct?
Correct.
Okay.
How do you feel about being the first patient?
I'm just excited that we have this opportunity. I don't think necessarily I'm excited about being number 1, just actually have the vaccination. But it is an honor. I wasn't quite aware of all of this, so.
I mean, as someone who, you are,
Very
right?
excited.
I mean, you've seen a lot. What does it mean, that patients seem to difficult things slowly but surely?
It's pretty amazing. I think we expected an expedited vaccine. I just don't think that most people is quick, coming. But like you said, being frontline and being offered the opportunity to be vaccinated is huge. It doesn't change much as far as our protocols, but it does offer us, personal protection. And the vaccine is found to be 95% effective, low likelihood of adverse reaction. So that's one of the reasons that I decided to move forward with receiving it.
Some of our, I know our district's significant preference and concern. What prompted you to raise your hand and say, I want to be first?
Well, first and foremost, I did my own research on it, aside from mainstream news, media, social platforms, really went to academic resources like American College of Emergency Physicians, up to date, JAMA, and went to Pfizer's website itself to get as much information as I could to make the best decision for myself.
Do you think this is knowledgeable?
Absolutely. Any information that you want, I think you should use from your primary care provider or some sort of healthcare provider. Stay away from, stick with reputable resources.
Way to go, Julie.
Come to mama, Julie. Come to mama. Oh, look, I get my paper. Hold on.
Andrew Barnes. Oh. Left shoulder.
Next up.
Oh yeah, great friends. You okay? Gonna make it?
Didn't hurt at all. Felt like a flu shot.
I agree.
Maybe it was technique.
Or the fact that there are people watching.
You're an RN, I see.
I'm an RN in the medical ICU.
I know you've gotten those two, but we also have a surgeon who's here
Okay, great.
doing it right now.
Okay.
So,
Hi. Could you say your name once more for me?
Andrew Barnes.
Okay, and how does it feel to be the first person vaccinated in Topeka?
I'm just happy that we have this opportunity, to offer a little bit more protection that is absolutely necessary.
And is this an honor to you? How does it feel just to know that, you're protected now and we're taking those steps to get there?
It is an absolute privilege to have this opportunity, and not to be the first person vaccinated by Stormont Vail, but just to have this available to myself and my cohorts, colleagues. This is big.
And how do you feel like this is just a progression for all of us, you know, moving
I'm sorry, I
forward?
can't hear you.
Sorry, the
No,
two
it's okay.
masks. How do you feel like this is just a progression moving forward for all of us, you know, having this center here now and seeing that people can get vaccinated here shortly?
Like Dr. Jones said earlier, it's not going to change much, you know, in the short term as far as, you know, wearing masks and personal protective equipment, but it does begin, you know, the cascade of events to vaccinate or immunize, you know, our immediate population to offer the freedoms we used to enjoy before March 12th.
Yeah, I definitely. Do you have anything you'd like to add?
I mean, there's always people that are skeptical and a little nervous.
Thank you.
Society in general is going to change, but sorry, Facebook, momentarily, I'm going to set you down. All right.
Are you one?
I just spoke with him, so I'm all good.
I didn't know what she was doing, so I didn't want to get in her way.
APRN.
So just can you tell us what this means? You're the first person in Topeka to get this vaccine.
Hi.
I wasn't aware that that was going to be I wasn't aware that was going to be so until like last night. I don't think it's about being number one. I think it's just about having the availability, the opportunity, and the other people to choose to get the vaccine.
All right, what's your name?
Vail,
Jason Louis, MD.
Pfizer, Biotech.
And how does this feel for you to be one of the first people vaccinated in Topeka? What does this mean?
Why were you sure that you wanted
Well, I didn't expect to be one of the first people in Topeka, but I feel great that I was honored to do it.
From reputable sources,
And how does this
such as the American
sort of
College
give
of
hope for our
Emergency
community to you? What are you
Pfizer,
thinking? What's going through your
Biotech,
head?
up to date.
Well, I think it's a great gift to our community, and what's going through my head is that somebody like me, who's a physician and frontline provider,
To be honest, I
should kind of
strayed from
give the example that this is something that we should do.
social media platforms.
And if I cannot do it, I don't know why I would expect. I don't see why my patients would do it if I can't do it.
sort of on the front lines?
So do you sort of see yourself as like an example of something
I
for
think
your
this will offer a
patients?
bit of easement.
Yes, for my patients and for the community as a whole, especially for me being a minority. I'm trying to show the minority folks that we should be involved, and
as well as a large part of our cohort.
probably the disease affects most minority in a disproportionate way, but also they don't have as much access to this kind of stuff. So I'm trying to show that the vaccination is available.
You are the
and,
number one person in
it's
Johnson County in Topeka.
it's fine, and
That's
it's not.
gotta make you feel good. You gotta
It's
brag
not
about
bad.
that.
It's
You know, I'm being goofy,
almost
but you
like
know,
getting the flu shot, but more
being
important
number
even
one
than
is an
that.
honor. Thank you,
And
Stormont
a lot
Vail.
of people have said that this is like
but
the light at the
it's-
end of the tunnel. Do you agree with that statement?
It is what it is. It's a vaccine
Partially,
that,
it's
you know,
not.
we've
It's not
needed
the
for a long
only
time,
thing.
and here it
We
is.
still have to do the other
Just keep
things
moving forward.
because we
You ever
still
tell your
don't know
grandchildren this?
Absolutely.
how long this thing
I-
is
you know,
going
I
to
told
provide
children
immunity. We
last
still have
night,
to
and
do
they're
the
all
other measures
very excited.
to help control
Hopefully
the
the DVR's
disease.
on at home.
We still have to do the usual things: social distancing, wearing masks, and all those precautions still have to be done.
Dying